Did you know that colon cancer is one of the most common cancers, but many people miss the early warning signs? Today, we're going to reveal the top 15 signs of colon cancer that you should never ignore. Stick around, because this information could save your life or the life of someone you love. Before we dive into the signs, let's talk about what colon cancer is and why it's so dangerous. Colon cancer starts in the colon or rectum, which are parts of the large intestine. It's one of the leading causes of cancer-related deaths worldwide. But the good news is that it's often treatable if caught early. Colon cancer usually begins as small, non-cancerous clumps of cells called polyps. Over time, some of these polyps can become cancerous. This is why knowing the signs and catching them early is so important. If we can detect it early, there's a much better chance of successful treatment and even a cure. Now let's look at those warning signs you should never ignore. Remember, catching these early can make all the difference. Number 1 sign is unexplained weight loss. Have you been losing weight without trying? This could be a sign of colon cancer. When the cancer cells start to use up a lot of your body's energy, it can lead to sudden and unexplained weight loss. If you're shedding pounds without changing your diet or exercise routine, it's time to see a doctor. Weight loss can seem like a positive change, but if you aren't actively trying to lose weight and it's happening quickly, it's crucial to get checked out. Your body might be telling you something important. Number 2 sign is abdominal pain. Persistent pain in your stomach or abdomen that doesn't go away can be another warning sign of colon cancer. This pain can feel like cramps, gas, or just general discomfort. Sometimes it might be easy to dismiss this pain as something minor, but if it's ongoing and doesn't seem to have a clear cause, it's important to pay attention. Abdominal pain that is consistent or worsening should not be ignored. It's your body's way of alerting you to a potential problem that needs medical attention. Number 3, diarrhea. Frequent diarrhea that lasts more than a few days is not normal and can be a sign of colon cancer. Diarrhea might be caused by the cancer interfering with your digestive system, leading to loose and watery stools. If you're dealing with ongoing diarrhea, it's crucial to get it checked out by a healthcare professional. Persistent diarrhea can lead to dehydration and other health issues, so it's important to identify the cause. If it's related to colon cancer, early detection can make a significant difference in treatment and outcomes. Number 4, bloody stools. Seeing blood in your stool can be alarming and is a serious sign of colon cancer. The blood might be bright red or dark, making your stools look black or tarry. Blood in the stool can be caused by bleeding in the lower part of your digestive tract. If you notice blood, even if it's just a small amount, it's essential to contact your doctor immediately. While there are other possible causes for bloody stools, such as hemorrhoids, it's crucial to rule out colon cancer as soon as possible. Number 5, rectal bleeding. Rectal bleeding is another critical warning sign. This can be noticed when you wipe or see spots of blood in the toilet. Bleeding from the rectum can indicate that there is a tumor or lesion in your colon or rectum. Any form of rectal bleeding should not be ignored, especially if it persists or is accompanied by other symptoms like abdominal pain or changes in bowel habits. Seeing your doctor right away can help determine the cause and ensure that you get the necessary treatment. Number 6, anemia. Anemia, or low red blood cell count, can make you feel very tired and weak. It often results from blood loss that you might not notice, such as bleeding within your colon. This internal bleeding can lead to a shortage of red blood cells, which carry oxygen throughout your body. If you're experiencing unusual fatigue, weakness, or pale skin, it could be due to anemia caused by colon cancer. A blood test can easily detect anemia, and further investigations can help find the underlying cause, potentially catching colon cancer early. Number 7, bloating. Bloating that doesn't go away can be another sign of colon cancer. You might feel full or swollen in your abdomen, even if you haven't eaten much. This persistent bloating can be caused by a blockage or tumor in the colon that disrupts normal digestion. If you notice constant bloating, and it's not related to diet or other common causes, it's important to talk to your doctor. Bloating might seem like a minor issue, but it can indicate something more serious going on inside your body. Number 8, weakness and fatigue. Feeling weak and tired all the time can also be a sign of colon cancer, especially if it's combined with other symptoms. Cancer cells can use up a lot of your body's energy, and blood loss from the colon can lead to anemia, both of which contribute to fatigue. If you're experiencing unusual tiredness that doesn't go away with rest, it's a good idea to see a healthcare professional. Persistent fatigue can impact your daily life and is your body's way of signaling that something might be wrong. Number 9, narrow stools. If your stools are narrower than usual, it could be a sign that something is blocking your colon. Tumors can constrict the passage in your colon, causing your stools to become thin or ribbon-like. Pay attention to any changes in the shape or size of your stools and report these to your doctor. While there can be other reasons for narrow stools, such as dietary changes, persistent changes in bowel habits should be investigated to rule out colon cancer. Number 10. Constipation. Persistent constipation can be a sign of colon cancer. If you're having difficulty passing stools or your bowel movements are less frequent than usual, it could indicate a blockage in your colon. Tumors can obstruct the normal flow of waste, leading to constipation. If you find yourself straining or feeling like you can't completely empty your bowels, it's important to consult a doctor. Chronic constipation, especially when combined with other symptoms, shouldn't be ignored. Number 11. Vomiting. Frequent vomiting can also be a sign of colon cancer, particularly if it occurs alongside other digestive issues. Vomiting can happen when a tumor causes a blockage in your colon, preventing food from passing through your digestive system normally. If you experience repeated episodes of vomiting, especially if they are unexplained and persistent, it's crucial to seek medical advice. Vomiting can lead to dehydration and other complications, so finding the underlying cause is essential. Number 12. Changes in appetite. A noticeable change in your appetite can be another warning sign. You might feel less hungry than usual or find that you feel full quickly after starting a meal. This can be caused by the cancer affecting your digestive system or your body's overall response to the illness. If you notice a significant and unexplained change in your eating habits or a sudden loss of appetite, it's important to discuss this with your doctor. Early detection can make a big difference in treatment outcomes. Number 13. Changes in stool frequency. A change in how often you have bowel movements can be a sign of colon cancer. This could mean going to the bathroom more frequently or less often than usual. If you notice a significant change in your stool frequency that lasts for more than a few days, it's important to get it checked out. This change can occur due to a tumor affecting the normal functioning of your colon. While there can be other causes for changes in bowel habits, persistent changes should be discussed with a healthcare professional. Number 14. Fatigue. Feeling constantly tired and weak can also be a sign of colon cancer. This type of fatigue is often more intense and persistent than regular tiredness. It might not improve with rest and can significantly affect your daily activities. Cancer cells can consume a lot of your body's energy, and if you're also experiencing blood loss from the colon, it can lead to anemia, which further contributes to fatigue. If you're feeling unusually fatigued and this tiredness doesn't go away, it's important to talk to your doctor. Thank you for watching. It's important to pay attention to these signs and talk to your doctor if you notice any of them. Early detection of colon cancer can make a big difference in treatment and outcomes. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to hit the subscribe button and click the bell icon so you never miss out on our latest health tips and information. Stay healthy and take care.